Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Ann-Louise Puopolo. She's a nurse executive, and the KevinMD article we're going to talk about is adopting technology to support the nurse workforce and provide smarter, safer care delivery. Ann-Louise, welcome to the show.
Thank you for having me, Kevin.
So let's start by briefly sharing your story and journey.
Sure. I started my career as a critical care nurse in Boston at Beth Deaconess Medical Center and became very interested in sort of health services research and progressed into looking at medical malpractice and patient safety in the malpractice world as sort of my next frontier. I worked in CRICO, which is Harvard's malpractice insurance company. I was the vice president of patient safety. And in that capacity, I had the opportunity to meet the organization I currently work with, which is DAX. I'm the president of the Safety Institute. And I'll tell you a little more about that as we continue our discussion. But I had the pleasure of meeting DAX because all of the hospitals affiliated with the Harvard Medical School utilized the safety software that the company provided. And in that capacity, we were able to use insights and data to help inform the senior executives that lead all these wonderful organizations about where some of the vulnerabilities are with respect to patient care and where mistakes are unfortunately leading to medical malpractice and unfortunately poor patient outcomes. I had the privilege at the end of my career as a patient safety officer to go to CVS Health. And in that organization, I was running their enterprise patient safety program across the retail pharmacies, the minute clinics, the mail and specialty pharmacies, the infusion and long-term care facilities. And in that capacity, we too used data to provide insights where we could optimize patient care and keep patients free from harm. So in my retirement, I am now at DAX heading an organization called the Safety Institute. And in that capacity, we have become listed with the Agency of Healthcare Research and Quality to be a PSO, Patient Safety Organization. And to remind your audience, the PSO movement started back in 2005 when the Congress passed a law that allows us to use data from malpractice mistakes and from safety event reporting, as long as we're not a health insurer, to learn from our mistakes in the spirit of confidentiality so that we can do something about these problems and share insights and improve upon the workflows so that these same harms don't happen in the future. So it's a wonderful vehicle in which to learn.
All right. So you wrote the KevinMD article, Adopting Technology to Support the Nurse Workforce and Provide Smarter, Safer Care Delivery. Tell us what led you to write this article and then talk about the article itself.
Sure. So as a nurse and as a nurse in the patient safety movement, I have noticed, especially in my role as being on the board at Tufts Medical Center here in Boston, that nurses are not oftentimes at the table when we're talking about what goes wrong. And as the sort of the center of the healthcare ecosystem, it seems like a real miss not to have them have a seat at the table where they can not only tell us what's gone wrong, but help be part of the solution. So I really wanted to speak out to nurses as being part of the safety movement in their own organizations. But I also wanted to make the point that without the data, and I don't just mean data that we can't do anything with, but rather actionable data that serves as real information that tells us where our problems are, it helps us to better address them. And so I'm really interested in this idea of connected health operations where we can look at risk, safety, malpractice, credentialing, workforce, all the various components of the healthcare ecosystem. If we can glean insights because that data has turned into actionable information, we will all be ahead of the curve. And then most importantly, Kevin, at the end of the day, what I care about is fostering a culture of safety. And we need to feel comfortable coming forward in our healthcare systems, whether you're a nurse or a doctor or any other kind of allied health provider, that you can bring forth vulnerability in the workflow that could cause patient harm. And if we can talk about it freely and bring it to the attention to our leadership before an accident happens, that better positions all of us to be part of the solution in delivering optimal patient care and keeping our patients free from harm.
When you talk about the actionable data that we could use more of, give us an example of what you're talking about.
Well, I think I addressed a little of that in the article. I mean, an example is an adverse event occurs. In this example, a nasogastric tube was placed in an emergency room setting after an overdose. And unfortunately, that nasogastric tube didn't make its way into the esophagus, but rather into the patient's trachea.
Yeah.
And ensuing respiratory distress brought that patient to the ICU. So in reflecting on what went right versus what went wrong, you would want to look at the data that suggests through the safety event reporting, how often has this happened? Has this time of the day of the week been a particular risk time? Are the individuals involved in the care properly educated and trained with how to insert a nasogastric tube? And was the equipment in good repair? And do we have other intelligence that suggests this is not a first-time problem, but rather has happened multiple times with similar themes? So those insights would then give us better positioning to address that problem and do something about it.
So the majority of healthcare institutions today, do they have similar systems that collect this sort of data? And if not, tell us about some of the barriers that prevents them from having that.
Yeah, no, we are very fortunate. The patient safety movement and the patient safety science has been around for upward of 25, 30 years. I would say every healthcare organization has some ability to bring forth when something goes sideways, but more importantly, the idea of a near miss, in other words, the harm didn't reach the patient, that's really where the rubber hits the road. And I would say the culture, unfortunately, is the impediment to people bringing things forward rather than the lack of a system in which to bring information forward. So we still have a lot of work to do in advancing the culture of safety around transparency without retribution as a result of reporting a vulnerability in the workflow.
And you alluded to this earlier in terms of culture being an obstacle. Are you saying that a lot of healthcare cultures have that punishment mentality, that retribution mentality when it comes to medical errors and patient safety, and that's preventing them from instituting transparency, technological innovations like this?
Unfortunately, yes, that remains the case. I would say it's still the minority that don't have the ability to bring forth things to their leadership, but we should have 100% adoption of a transparent environment where retribution does not play into the equation. I'd say we still have some work there to do.
In your article, you touched upon the nursing shortage and nurse burnout. Tell us about how that intersects with some of the technological approaches to solving that.
Right. Well, here's the thing. We've long had technology in the workflow. I mean, you know that as a physician, I know that as a nurse, but sometimes the technology is not our friend. For example, many of us who practiced back in the day struggled with alarm fatigue. There were too many buzzers and whistles to tell you, Houston, you have a problem. You're going in the wrong direction. And what did we do? We kind of stopped hearing those noises, right?
Yeah.
So the technology was there to help us, but in fact, it sometimes became a burden. So I believe that technology as our friend has got to be well positioned where it supports the workflow, it hardwires, helping us to always do the right thing by not leaving it up to training and education and muscle memory to remember what to do with any given task. And again, it doesn't matter who the healthcare professional is, we are all burdened with a lot of tasks. So technology should support the workflow, but not overwhelm us with alarms and whistles that tell us we're going in the wrong direction, but rather stop the line, make us do something differently, or not allow us to go forward without simply an alarm alerting us.
Yeah. And in terms of involving more nurses in these healthcare decisions in terms of which technology to implement? What kind of recommendations would you use or would you have for healthcare leaders to better involve nurses?
Well, here's the thing. The three domains that we see every time something goes wrong includes technology. So as I said, it can be your best friend or be your enemy. Workflows in the spirit of standard operating procedures. And then the third domain is human behavior. Those three elements are oftentimes involved in the vast majority of things that go wrong. Two, usually three of those domains are involved. So truly understanding where the vulnerabilities are in those three buckets when you are dissecting a safety event will enormously help in providing the insights about what we would do differently to mitigate those things from happening in a future state. And I think anyone would be hard pressed to say it's always the same problem. It is usually sort of a tripod, if you will, of domains of problems when something goes wrong.
Of course, we're in the advent of artificial intelligence, and tell us about how that could be used to help with the technology fatigue that you mentioned earlier, as well as improve the transparency when it comes to medical errors and improving patient safety.
Well, like many others, and I'm sure you're included, we're very excited about the use of artificial intelligence. For the most part, we think this is really going to be an enormous benefit in delivering patient care. Of course, there's always those, and I'm probably one of them that's concerned that we may have an unintended consequence as a result of using artificial intelligence. But for the vast majority of what we need to do in delivering high quality patient care, AI is going to play an enormous role. I mean, if you think about it being sort of a surveillance capability within the medical record that can help guide us to doing the right things at the right time in a form of decision support without us actually being fed or mandated to do something differently, but rather being given real-time actionable information rather than hindsight. And I think it is the new frontier, again, used responsibly, and of course, always with the human looking it over and make sure it's working as designed.
So tell us a scenario where some of your technological innovations can address both of the things that we've been talking about today. Number one, nurse burnout and nursing shortage. And number two, of course, the medical errors and increasing patient safety. Give us a case study or a story that can really illustrate some of the concepts we've been talking about.
Well, I think there's unfortunately many. The things that we see most often in a lot of healthcare setting is a medication error. And there are many parts to making a medication error, starting with the order itself, which more times than not is developed by our physician colleagues. And then that order becomes part of a process that goes through a pharmacy in a series of checks and balances in filling that prescription. The prescription then becomes, at least in an inpatient setting, the responsibility of the nurse to deliver. So the buck kind of stops with nursing. Nursing can either be a contributor, should there be something wrong with that medication order in dispensing of that medication order, but they can also be the last stop before harm reaches the patient. So in that regard, I feel like the process of medication errors is really a good example that it travels through a myriad of professionals in order to reach the patient. And there are a multitude of things that can go wrong along that journey. Wrong patient, wrong drug, wrong directions, wrong dosage. There are several buckets there that become vulnerable. So when you have safety events reported into a system in any given organization, you should be able to pull out the causal and contributing factors when a medication error occurs, to be able to look at it not just one by one, but rather in the aggregate. Are we seeing themes? Are we seeing patterns as to what drugs are involved, time of the day of the week, the experience and the knowledge of the providers involved? Is there technical failures in barcoding and any automation that is part of the drug dispensing capability? And in looking at that information, one should be able to understand where we need to be doing things differently, because it's more likely than not that those causal and contributing factors are clustering in a particular area. So this is where AI is going to play an enormous role in looking at patterns of information and helping us to think about what makes the best sense to work on first to make it a non-event. In other words, not letting it happen again.
We're talking to Ann-Louise Puopolo. She's a nurse executive. Today's KevinMD article is Adopting Technology to Support the Nurse Workforce and Provide Smarter, Safer Care Delivery. Ann-Louise, let's end with some take-home messages to the KevinMD audience.
Thank you, Kevin. I think the most important thing that I want to leave our audience with is that nurses deserve a seat at the table. They are a trusted and respected member of the healthcare team. Let them work with the entire leadership team to be part of the solution. And with that, I'd like to leave the audience with the idea that doing the right thing always is necessary. And so fostering a culture of safety, bringing forth vulnerabilities in our workflow, in our standard operating procedures is a blessing. And we need to keep an open mind as executives in leading our healthcare organizations to embrace people for catching these problems early and celebrating them in good catch programs.
Ann-Louise, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thanks for having me, Kevin.